A case study, also referred to as a case report or case review, is a form of primary research that collects and describes information about an individual patient, project, community, or event. Case studies focus on description and documentation rather than experimentation. In the health sciences, case studies often result from the investigator's clinical encounters with a patient experiencing a specific disease or disorder and document what is unique or atypical in that case. Researchers collect data on participants using observations, interviews, tests, and patient records. According to evidence-based practice, case studies are considered a very low level of evidence because they are only based on one or a few patients and are not based on a rigorous methodology. In other words, because the sample size of case studies is small, it is argued that the results of the research cannot be used to make generalizations. However, case studies do have value. They allow a researcher to study a specific aspect of health in far greater detail than an experiment with hundreds or thousands of participants. Case studies illustrate for practitioners and researchers how different aspects of a patient's life are related to each other. And, rather than seeking quantifiable data, case studies pose questions that may lead to further inquiry or research. Let's look at two examples of case studies and talk about the format and characteristics. How do you know that you're looking at a case study? Oftentimes, they'll label themselves with the words case study, case report, or case review in the title, abstract, or introduction. However, it is best to use the content of the article to determine if it is a case study rather than rely on the title. Case studies usually follow a typical format with similar section headings. Like most scholarly journal articles, case studies have abstracts, or summaries of the article. After the abstract, you'll often see an introduction or background section, which provides context for the article. Look for information that shows the article is focusing on a single patient, project, community, or event. In the Circle of Care for Older Adults with Hearing Loss and Comorbidities, a case study of a geriatric audiology clinic, the sample size is a number of patients in one clinic, while another article, Newly Acquired Fear of Falling Leads to Altered Eye Movement Patterns and Reduced Stepping Safety, a case study, follows a single 87-year-old patient. Following this section will be the case presentation or case description, where the details of the observations, interviews, tests, and patient records are explained. Depending on the article, this might be labeled Methods and Results or Case Report. Both of our examples use Methods and Results as their section headings. In the case study on the audiology clinic, the authors used patient records and focus groups as their evidence. The case study about stepping safely used multiple recordings of the patient's eye movement patterns, stepping characteristics, and a range of sensory and psychological measures over time. Discussion and conclusion are the sections that follow. When there is a discussion section, it provides a space for the author to put in additional comments or to place the case study in context. The conclusion is where the authors try to let the reader know what they should have learned from reading this article, or they analyze the clinical impact of the case. When a case involves accessing patient records, a section of consent will be present that shows that the researcher received written informed consent from the individual or individuals they are profiling. For example, in the case study about stepping safely, this is found near the top in a section called Ethics Statement. The last section in any case study is a list of references, where the authors list works that they have cited and referred to in the case study. To summarize, case studies describe an individual, project, community, or event using observations, test results, interviews, and patient records. While case studies are considered a very low level of evidence because they are only based on one or a few patients, they provide an opportunity to explore questions and examples that might lead to further research. If you need help identifying whether an article is a case study, contact SCC librarians or use the 24/7 Ask a Librarian chat feature from our library homepage.